In addition to seeing abnormalities of the chromosomes involving extra or missing of entire chromosomes, we often will see pieces of chromosomes that can be missing or extra, which we call microdeletions and microduplications. There are certain regions of the chromosomes that are more susceptible to breakage, and these are called low copy number repeats. And so these areas, because of non-homologous recombination, we will often get abnormal crossover between the chromosomes, and because of that, you can have deletions and duplications involving the same region of the chromosomes. And we see these microdeletions and microduplications on a regular basis. This is a list of some of the common microdeletions and microduplications that we see, although there are several more of them. These are the ones that you would probably be most likely to see in your genetics clinic. By far the most common that we are aware of would be the 22q11.2 deletion syndrome. This condition has been called many other things, such as DeGeorge syndrome, velocardiofacial syndrome, and others, such as Sprinson syndrome, who is the geneticist who named this condition initially. DeGeorge syndrome is typically in those babies who are diagnosed at birth, who have heart defects, and majorly sick babies, usually. Whereas velocardiofacial syndrome is typically seen in children more so just a speech issue, certain facial features, and can still have cardiac issues, but are typically more mild than those babies that would be classified under DeGeorge. But honestly, they all have the same condition, it's just a spectrum. And we see this condition in about 1 in 4,000 to 1 in 6,000 individuals, and it's quite possible that the incidence could be higher, as not all individuals with this condition will actually have a diagnosis. And about 10% of cases will be inherited from an affected parent. So the most striking information, or the most striking features we see with this condition, would be congenital heart defects. Typically, we're going to see conotruncal malformations such as tetralogy of Fallot, interrupted aortic arch, VSDs, and truncus arteriosus. They will often have some sort of palatal abnormalities, either being an actual cleft palate or a milder case of a submucous cleft palate, bifid uvula, or just a palate that doesn't move well, called velopharyngeal incompetence. They also will have typical facial features, and these are going to be more commonly seen in individuals of European heritage. Other ethnic groups, it's not quite as obvious. And they typically have some degree of learning difficulties. Some of them will be classified even under intellectual disability. And occasionally we will also see an immune deficiency, and sometimes that can just manifest as abnormal T cells, whereas some kids are actually very sick. So here are the facial features that we can see with this condition. You can see the broad nasal root, and they also kind of have just a lack of good facial expression. So when they smile, their face doesn't really move much. They also have this kind of typical nose that you will often see, sometimes small ears, overfolded helices, and their fingers tend to be really long and sometimes even tapered. As I stated before, that this deletions of regions can have an equal duplication. So the 22q11.2 duplication is generally mild, but is highly variable. So we can see apparently normal individuals to individuals with intellectual disability or learning issues. There can be delayed gross motor development, and even growth development, or size and weight can also be delayed. and they can have low muscle tone, which is typically what causes the gross motor delay. This is actually, we believe, seen in about 1 in 700 of individuals that have developmental delay. So it can be much more common than we think. And these are actually a couple of patients of mine with this duplication. So the child on the left was the one who presented initially because of gross motor delay, speech delay, and he also had laryngomalacia. So he went under microarray and was found to have this duplication. We then tested the parents and found out that dad has the same thing. Dad had some mild issues in school, but really was mostly just deemed hyper and didn't really require any assistance. So nothing really too remarkable. And so because dad had the duplication, we then tested the little brother, and he too has the duplication, but so far seems to have relatively normal development, although he is still pretty young. Now the 15q11.2 deletion can cause one condition called Prader-Willi syndrome. And this deletion is when the paternally inherited chromosome is missing, or the piece, the 15q region. These individuals have severe hypotonia and feeding difficulties in early infancy, and then later they progress to having excessive appetite and increasing morbidity or increasing obesity because of this excessive appetite. They just don't feel full. They just constantly are eating. They're hiding food. They're stealing food, and so it's a major issue as far as their behaviors involving food. They also have motor milestone and language delays, and all of them will have some degree of cognitive impairment. Now, if there is a deletion of the maternally inherited chromosome, that causes Angelman syndrome. And this is a severe developmental disorder with intellectual disability, often absent speech. They have an ataxic gait or kind of shaky gait, and they have a unique behavior where they laugh inappropriately, constantly smiling. They have a really big mouth when they smile. And it's also called the happy puppet because of the way they hold their arms up like it's connected with strings, and they're kind of shaky ataxic gait. They typically will also have microcephaly and seizures. Now, individuals with a 7q11.23 deletion have Williams syndrome, and these kids are very cute, wonderful personality. That's kind of the biggest thing that comes out is they come right up to you, they smile, they give you hugs, they want you to hold them even when they're 1 and 2, and they should be scared of strangers. Oftentimes what will pick them up is a diagnosis of a cardiac defect, specifically supravalvular aortic stenosis, and they typically will have some degree of developmental delay. We expect that most of these individuals will have intellectual disability, although it can be on the milder end. They usually talk, they usually are very social, but just their depth of understanding is less. And they have these certain facial features that you can see in the picture here, and they can also have a stellate or lacy iris pattern, which is something that you can notice just on a physical exam. And we also have to watch them for hypercalcemia. The 5p15 deletion is called Cri-du-Chat syndrome, and that's because these babies have a really high-pitched monochromatic cry. So it's like you hear them in the NICU and you're like, oh, that doesn't sound right. They have a small head, broad nasal bridge, epicanthal folds, small chin, and severe developmental delays and intellectual disability. The deletion ranges from the entire short arm all the way to the region of 5p15. So it can just be that small 5p15, but a lot of times it's a larger deletion of the short arm. And the incidence ranges from 1 in 15,000 to 1 in 50,000, depending on who you ask. 4p16 deletion is called Wolff-Hirschhorn syndrome. They have typical facial features as well, which we call the Greek warrior helmet appearance. I'll show you some pictures. They have a small head. Their eyes are widely spaced, hypertelorism, and they have highly arched eyebrows. And their mouth tends to be downturned, small chin, and their ears are abnormal as well. They're usually very small at birth and continue to be small and have hypotonia, which results in gross motor delay. They will also have intellectual disability of variable degree, but from my experience, most of them are pretty severe. And they will also have seizures in most all of the children and individuals. The prevalence is about 1 in 50,000. And here are some pictures of some individuals with this deletion of varying ages. So you can see kind of the arched eyebrows. They called it the Greek warrior helmet condition because I don't know if you remember the Greek warrior helmet, they had like a kind of like a nose, that a piece of metal that covered the nose, the bridge of the nose, and then it arched around the eyes. And so that's kind of most of these kids kind of look like that. The 17p11.2 deletion is called Smith-Magenis syndrome. This includes deletion of the RAI1 gene. They too will have distinctive facial features, but these do progress with age. They will often present with developmental delay and behavior issues. Behavior issues are kind of their main thing that is of concern. They have significant sleep disturbance, and they are also self-injurious. So they hurt themselves, they bite themselves, scratch, pull their fingernails out. They insert objects into body orifices, which, not just up their nose, but sometimes in the rectum. And they also will have a self-hug behavior. We see about the incidence ranges from 1 in 15,000 to 1 in 25,000. And here are some pictures where you can see children, infants with this condition to early school age to adolescence, and how their facial features change. And a lot of times these kids do have issues with obesity as well.